Hi everyone, my name is Agnes. I thought I should do a YouTube video to share my journey with bowel cancer and chemotherapy treatment. So this is my journey, my experience and my story. Hi everyone, welcome back to my YouTube channel. In today's video, I'm going to talk about bowel surgery for bowel cancer, my experience, pre-op and post-op surgery. So just a little bit of a catch up from last time. So my diagnosis and the surgery was only a week apart. So that was very stressful because I didn't have enough time to prepare myself, but it had to be done. So perhaps maybe it was a good thing that I didn't have to think about it too much. I just had a week to just do it and not dwell on it or anything like that. So the day of the surgery, as it was kind of like an emergency surgery, went into hospital a day before just to have the pre-op prep and blood tests and scans and all that. So that was done, and came the day of the surgery, had the surgery, and obviously the consultant suggested that I should perhaps stay one night or 2 nights in ICU, which is like an intensive care unit, which I did, and then was transferred to a ward. So that's when the fun began. One kind of like thing that they did was to make sure that you are mobile as soon as and take off all the kind of like the catheter and make you move really, and that's part of the healing. So the type of surgery that I had, it's called, the medical term is called right hemicolectomy, which is the right hand side of my bowel, from kind of like in the middle of my belly down on the right hand side. So that section is now gone. At first I thought, oh my God, I might feel a little bit lopsided, but no, I didn't. And I thought I might feel maybe one side of my belly flatter than the other, but no, it looks the same, to be honest. And so that's the medical term for it. So where they cut from the top part of your belly, that section, then it's joined with the bottom part of the belly that's been left. And then they removed 5 lymph nodes. And so that was a stage 3 bowel cancer with 5 lymph nodes. They kind of like have a medical term for it, like T3 and something, and M means it hasn't metastasized. So MO, which means it hasn't metastasized, I think that's the right word, where it hasn't spread to other parts of the body. And so 2 days into that in a ward, I had the physiotherapist come in to help me move about, and gave me some exercise, which was very helpful. And then kind of like day 3, I had excruciating pain. And so I called the doctor and they came, and then they gave me kind of like a morphine on a drip where I can control how much, when do I need it, instead of kind of like relying on the nurse to come in and give it to me. So I did that, but apparently according to them, I wasn't using it as much as perhaps they expected me to use it due to the amount of pain that I was in. But I have a very bad experience with morphine, so maybe I was just trying not to use it too much, and then maybe using it at last minute when I was in a lot of pain, which probably didn't help. And that came off after a couple of days because I didn't really need it then, and I was pretty much mobile. But then I developed an infection, which was kind of like a surprise. Well, not really a surprise because it's bound to happen. It's one of those things that you kind of like consent and kind of expect, but not expect at the same time to have the infection. So one night I just woke up and I was covered in blood on my belly. Anyway, informed the nurse, and they just said they were going to review it in the morning. But the funny thing is, all my blood tests were coming back normal, no signs of infection. But it turns out that yes, I did have an infection called Klebsiella, which is like an infection that stays in your intestine, and also it can spread. You spread from kind of like healthcare to patient kind of infection. So it meant that I had to go back to theatre and have the where they did an opening in the middle. One thing I forgot to mention, the type of surgery that I had done, it's called hemi. So when I went to see the consultant before surgery, another thing that he had picked up was, because I had two MRI scans, one where the gastroenterologist had suggested to have one MRI scan and then go back and then I had to go back and have another MRI scan just of the liver, because he had seen the lesions. So when I went to see the surgeon, when he was looking at both MRIs, he thought that the cancer had spread purely because of where the two MRI scans, when he joined them, he could see that one part of the lesion was on the other side of the bowel. So he thought it had spread. Then he discussed it with his colleagues and then said, no, it looks like on one of the MRI scan, perhaps I was just lying too much, kind of twisted to my right hand side. So then it kind of showed as if the tumor or the cancer had spread, but it hadn't. So that was a relief. But that was a very stressful kind of moment to think that it had spread. So he kind of like had to prepare myself. If it had spread, then I would have had to have the bag, the colostomy bag. But thankfully I didn't have to have the colostomy bag in the end. It was just a matter of just removing half of my bowel and then stitch it back together. And let things heal and remove the tumors as well. Thank you for watching this video, and please do let me know on the comment section. I would like to learn as much as I can as well myself. And also don't forget to subscribe so you won't miss any videos coming up next. Thank you.